Hi, my name is Ong Hui Shin. Today I will be talking about rheumatic fever. What is rheumatic fever? Rheumatic fever is a type of inflammatory disease that can affect the heart, joints, brain, and skin. It can cause permanent damage to the heart, including damaged heart valves and heart failure. Rheumatic fever will develop when strep throat and scarlet fever infection are not well treated. Strep throat and scarlet fever are caused by an infection with Streptococcus bacteria. Rheumatic fever is thought to be caused by the body's immune system. The immune system will respond to the earliest strep throat or scarlet fever infection and causes a generalized inflammatory response. Children between age 5 to 15 are commonly affected, but older children and adults can also develop this disease. The disease is common in sub-Saharan Africa, South Central Asia, and among certain populations in Australia and New Zealand. Now I will be talking about the symptoms and consequences of rheumatic fever. The symptoms include fever, painful arthritis in the common areas such as knee, ankles, elbows, and wrists. Symptoms of congestive heart failure, such as chest pain, shortness of breath, and fast heartbeat, can also be experienced by the patient of rheumatic fever. They will also experience fatigue, chorea, vomiting, heart murmur, enlarged heart, fluid around the heart, small painless bump beneath the skin, and also chest pain. Inflammation caused by rheumatic fever can last a few weeks to several months. This can lead to long-term complications, such as permanent damage to the heart, or we can call it as rheumatic heart disease. This disease usually occurs 10 to 20 years after the original illness, but in several cases of rheumatic fever, it can cause damage to the heart valves while a child still has symptoms. Narrowing of the heart valve will lead to decreased blood flow. Leakage in the heart valve will cause blood flow in the wrong direction. Damage to the heart muscle will affect the heart's ability to pump. Atrial fibrillation and heart failure is also the consequences of rheumatic fever.
Now that we have come to the causes, let me, Heng Yi, expose to you the root of rheumatic fever. It originates from a type of group A streptococcus known as Streptococcus pyogenes. It is capable of causing a wide range of diseases, ranging from mild pharyngitis to severe toxic shock syndrome. A repeated group A streptococcus infection is reported to trigger an autoimmune response that ultimately leads to rheumatic fever and its other consequences. There are basically three known pathways that have been identified in the development of rheumatic fever by Streptococcus pyogenes. Firstly, is through direct infection. Secondly, through the effect of streptococcal toxin. And last but not least, by the antigen mimicry in malfunctioning immune system. Without further ado, let Ahmed explain to you in details about the mechanism of infection.
The primary transmission routes of Streptococcus pyogenes are through respiratory droplets and via direct contact. The nasopharyngeal mucosa and skin are known as principal sites of asymptomatic gas colonization. The transmission is facilitated by the ability of gases' adherence to the host cells using their lipotecoic acids, cell surface proteomes, villi, and M proteins. The bacteria can internalize in the host and then develop resistance to host immune defense systems. The initial pharyngeal infection leads to activation of innate immune system and gas antigen presentation to the adaptive immune system. This in turn activates the CD4 T cells and B cells, leading to secretion of gas antigen-specific IgG and IgM antibodies. The structural similarities between pathogenic antigens and self-proteins lead to autoimmune reactions mediated by gas-specific antibodies and O T cells. The reactivity manifests clinically as rheumatic fever.
There are a few ways to diagnose rheumatic fever. Firstly would be the rapid strep test. It is to determine the presence of group A strep infection in the patient's throat. Next would be the blood test. It is to determine the presence of antibodies to know whether the patient had a group A strep infection recently. Third would be the electrocardiogram. It is an electrical tracing of the heart to detect abnormal heart rhythms suggesting the inflammation. Fourth will be the echocardiogram, an ultrasound test that uses sound waves to produce live images of the heart to show inflammation or heart valve damage. As for treatments, bed rests are recommended to the patients for at least a few weeks to a few months if the fever has caused heart problems. Antibiotics are also given to patients, such as penicillin, to cause immunologic response. Next, anti-inflammatory treatment is given to patients as a pain reliever, such as aspirin or naproxen, to reduce inflammation, fever, and pain. Not only that, corticosteroids are also given to lower down the inflammation. Prednisone is another corticosteroid as another option if patient does not respond to the first-line anti-inflammatory medication or if there is inflammation to the heart. Lastly, anticonvulsive medication is given for severely involuntary movements caused by pseudocamphoria and anti-seizure medication such as valproic acid.
Hi, I am Yiheng. I'll be concluding what my teammates presenting about rheumatic fever. In summary, rheumatic fever is a type of inflammatory disease that can affect the heart, joints, brain, and skin. The inflammation caused by rheumatic fever can last a few weeks or several months, in which will lead to long-term complications. Permanent damage to the heart usually occurs 10 to 20 years after the original illness, but several cases of rheumatic fever can cause damage to heart valve while a child still has symptoms. These are summarization of the symptoms and the consequences: narrowing of the valve, decreased blood flow, leak in the valve, blood flow in the wrong direction, damage to the heart muscle, affecting its ability to pump atrial fibrillation, and heart failure. The rheumatic fever caused by group A streptococcus known as Streptococcus pyogenes. The structural similarities between pathogenic antigens and self-proteins lead to autoimmune reaction mediated by the specific antibodies and or T cells. In conclusion, rheumatic fevers still stay as an infection that is as yet disrupting the creating economy of the world and incomprehensibly where assets are ready to control it. In this manner, avoidance and proper treatment of rheumatic fever in youth is exceptionally vital to reducing this illness. This is our reference. Thank you for listening to our presentation. Thank you.